people surrounding us. Now this RAS, it is the full form of RAS is the reticular activating system. It mainly conducts the impulses to the cortex, then arousal, etc. So its main function is to receive the information from the spinal cord and relay it to the thalamus or to the cerebral cortex. Now this RAS function as the arousing system that alerts the body, hence maintaining the consciousness. So the three global brain states that we have is the number one, the awake, number two, asleep, and number three, dreaming, are controlled by this RAS located in the mesopons. It is just in between the pons, and there is a region that is known as the mesopause, and these three global brain states are controlled by this RAS. So these states develop and occur in the predictable manner depending upon the firing properties of neurons, that is synaptic connectivity and the sensory inputs. The amphetamine is a drug. There is a drug, the psychiatrists always use this type of drugs. So it induces the stimulatory influences on the cerebrum, thus enhancing the wakefulness. So if there is a drowsiness, if the patient complains that there is a drowsiness, then this type of amphetamine is always prescribed by the psychiatrist to wakefulness or alertness. Now then comes the pineal body. It is a region placed little above the midbrain, and there is a gland that is the melatonin. And this melatonin, it is an hormone. It helps in synchronizing the body functions with one another as well as regulating the reproductive hormones. So for humans and other mammals, it plays an important role in promoting also the sleep and regulating the circadian rhythm. So these are all about the brain processes related to our consciousness. Now the next portion is the disorders. What are the disorders of this central nervous system? Now when the brain is damaged due to some problems or some injury or maybe some accident or due to some operations or some drug effect, etc., then what happens? There is damage in that particular area, and for that damage we the organs, there is a difficulty in movement, in speaking, in swallowing, in muscle movement, etc. So what are they? There are some important diseases of this or for this disorders of the central nervous system. So number one, it is the Alzheimer's disease. Now it is a very common disease. You may know this name, dementia, Alzheimer's. Now this is mainly it is known as the degeneration process, because it actually destroys the neurons present in the brain, and this influences the individual's whole cognitive processes, maybe the memory, the attention, the perception, all the motor responses, etc. Now this degenerative disease is also termed as the dementia, and the Alzheimer's disease is the most common cause of this dementia. So there is a cause and effect relationship between these two names. So the cause identified is mostly genetic here, number one. And what happens? The people suffering from this difficulty, mainly I told you that is all the cognitive aspects. Number one, the memory, then the remembering any name, any place, any number, etc., or name of any people, or the attention becomes very short, the attention span becomes very short, and they have great difficulty in the personal maintaining the personal hygiene and retaining any mental abilities. So you must have heard about the AIDS, AIDS, that is the acquired immune deficiency syndrome. It is caused by the attack of this HIV virus. So it may infect. What happens here? It firstly infect all the neurons present here, and that lead to the progressive degeneration of the brain, and ultimately what happens, this dementia, it occurs. There is another disease, that is the Huntington's disease. It is also a genetic disease, and that results in the involuntary movements that are not desired. So it may be sometimes fatal. So a person may also die because there are some disorders, some problems which are very severe. Now the next one is the Parkinson's disease. It is also very common. You must have known this name of this disease. So it is very common among males, and mainly the middle age and the old age. It starts from the middle age, and it goes to the old age also. And the most common symptom is the tremor. That person tremors all the time, and during doing any activity he tremors, and but not during any voluntary movements or during sleeping. And it is characterized by the cognitive deficits. That means all the cognitive aspects, there is a problem or deficit in all of these cognitive aspects. Now the third one is the stroke. So it is also a very common name that I think all of you know. So sometimes any injury or any disease may destroy the fine tissues present in the brain, or neurons, which affects the motor movement, number one. Now it also, there are two causes of this stroke. Number one, the cerebral hemorrhage or bleeding in the brain, or the cerebral ischemia, that means the interruption in the blood supply. So if there is any blockage in the region, so what happens, there becomes an interruption in the blood supply to an area of the brain, and from there bleeding starts, and the blood clot, it restricts that region, and there is a blockage. So what happened? The motor, there is a restriction in the motor movement, and the paralysis occurs. And so these are the main cause of this stroke. Now the cerebrovascular accidents, that is CVA, it is also known as CVA. That means the blood flow through the vessels is stopped due to hemorrhage. So in between there are some hemorrhage, and for that hemorrhage there is an obstruction in the blood flow. Then what happens? This stroke occurs. So this causes some lack of oxygen present here in between the vessels, because there is a blockage in between due to the hemorrhage. And if the neurons die, then it leads to damage in this motor neurons, and thus leading to partial or complete paralysis. That means one side of the body, that patient will not be able to move his hand or limbs. Now, apart from paralysis, some common problem occurs, like problem in language, that is aphasia, or amnesia, that means memory loss, or in severe cases, coma also occurs, this stroke patient. Now, after this, the multiple sclerosis, it is another important disorder, or it is also known as autoimmune disorder, and a progressive disorder that attacks the covering of the neuron, that is a myelin sheath. You have already learned this myelin sheath, and it is actually a protective covering of the axons of the CNS or central nervous system. So the usual onset of this disease is during it starts from very young age, and common symptoms are like visual disturbance, muscular weaknesses, then tremors in between, then some problems of ataxia, etc. So these are some of the important symptoms of this multiple sclerosis, and there are some. So this is also known as the autoimmune disease, which remain largely the cause is not known still now, because sometimes it is also known as a genetic problem, but sometimes it is also known as the problems of any type of immunological disorder or immunological problem. And there is growing consensus that autoimmune diseases likely result from interaction between the genetics. It may be a cause, the most important cause may be of gene, due to the gene or genetic problem, or maybe due to some environmental factors or problems. So this is all about the multiple sclerosis. Now next come to the cerebral palsy. It is common or it occurs during the childhood, mainly the early childhood, when there is any damage in this region of the brain tissue, or it is infected by some viral attack, maybe some bacterial attack, or due to some trauma, reduced oxygen during the birth, etc. So this causes the permanent damage to the movement of the body muscle, and the voluntary muscle controls is impaired and causes spastic paralysis. That means that that child will be unable to move because there is a problem in the limbs and the arms, etc. And it affects sometimes it affects the one side of the body, and sometimes it affects both the sides of the body. Now comes the scissor disorder. It is in Bengali. It is known as torka. আমরা বাংলায় এটাকে তর্কা বলে থাকি, বা ফেন্ট হয়ে যায় যেখানে বাচ্চারা. So this is characterized by sudden burst of scissoids. There are some sudden scissoids due to some high temperature maybe, or maybe some loud noise, or etc. So it causes, or that cause a temporary change in the functional of the brain, and what happens that that child or that person becomes unconscious, and there is a restriction in motor activity or muscle contraction. And it is also one example of this is epilepsy. And here what happens, the frequency and the severity of the scissoids can be controlled by giving some medication of the nerve, but actually it cannot be cured. So it remains, but what happens, the severity and the frequency can be controlled by giving some nerve medication. So in amnesia, the another or the last disorder of central nervous system, it is the amnesia, which means the loss of memory. Now, while other mental functions are working, only the loss of memory happens. And it cause can be some stroke, infection due to some bad effects of drugs, oxygen supply less or loss of oxygen loss, or due to some tremor, epilepsy, etc. So this Alzheimer's or maybe sometimes due to this Alzheimer's disease also, amnesia occurs. Now, amnesia can be of two types, or mostly it is due to the psychogenic cause. That means due to some trauma, due to some hypnotic suggestions, etc. And in some classical case of some HM, that is, the amnesia was due to the bilateral damage to the medial temporal lobe. That means the damage in the bilateral area where both the sides are affected, and which includes hippocampus. So it is the main region where this problem occurs in the brain. And the what happens, the restriction occurs in the perception, in the cognition, in the intelligence or IQ of that person, any action, and also in the memory. That means the working memory or the short-term memory or any type of remote memories, etc. And sometimes in the non-conscious or the implicit memory, etc. That lack awareness of the previously experienced information. So amnesia may be of two types, that is anterograde amnesia, which refers to the post-damage memory. That means when this problem occurs, the memory of when the time or where this problem occurs, just the past memory of that situation is forgotten by the patient. So that is the anterograde amnesia. And what is retrograde amnesia? It means the immediate memory loss. That means just that what we are eating now, what we have eat in the breakfast. So this is all about the immediate memory. But anterograde amnesia means in which school I was in, or maybe the name of my best friend in class 2, etc. So these are the examples of this anterograde amnesia. So this is all about this chapter. It is almost time, so let me start with the peripheral nervous system. I will just give you an introduction of this chapter, and after that I will just tell you to ask any type of questions that you have. So let me present this PPT with you. Just a second. Yes. So this is the next unit or next chapter, that is the peripheral nervous system. So in this chapter, we will first study about all the cranial nerves. As you all know, there are three types of cranial nerves, that is the sensory, the motor, and the mixed cranial nerve. Now, what are these three types of nerves? Now, from the name itself, you know that sensory cranial nerves have some sensory axons and are involved in only the sensory functions. Then the motor cranial nerves, it consists of axons that are involved in movement or motor function. And the mixed cranial nerves have both sensory and the motor function. So they are named as mixed cranial nerves. Now, we will study about what are the names of these cranial nerves, or how many cranial nerves are there. Now, cranial nerves 1 to 4 are in the midbrain and the forebrain. See in the screen, cranial nerve 1 to 4, sorry, it will be 4, there is a mistake. It will be 4, just, okay, I am here, it will be 4. Okay, so cranial nerve 1 to 4 are in the midbrain and the forebrain, while the cranial nerve 5 to 12 are in the which region of the brain? It is in the medulla and the pons. Now, This there are 12 important nerves that you will study in this chapter. They start from the olfactory nerve. That is number 1. That is the olfactory nerve, and it have axons of neurons whose dendrites and cell bodies lie in the nasal mucosa. Then comes the optic nerve, the oculomotor nerve, trochlear nerve, trigeminal nerve. Again, this trigeminal nerve may be divided into ophthalmic, maxillary, and mandibular nerve. Then number 6, it is the abducens nerve. Then the next slide, number 7, it is the facial nerve. Number 8, it is the vestibulocochlear nerve. Glossopharyngeal nerve, number 9. Number 10, vagus nerve. Number 11, accessory nerve. And number 12, it is the hypoglossal nerve. So the next day, I will go in detail about all these nerves and what is the spinal nerve and what is the somatic nervous system. Let me show you the next slide. See, these are the spinal nerves. Then what about the somatic nervous system, or how many parts are there in the somatic nervous system? What are the reflexes present? And what is the autonomic nervous system? It mainly is divided into 2 parts, the parasympathetic nervous system and the sympathetic. Now, what are the organs, or what are the regions which are responsible for this parasympathetic and the sympathetic nervous system? That I will go in detail in the next class. So it is all about this chapter. Now you can ask me any question that you have. Yes. Any one of you? Yes.
Ma'am, in page 64, where the frontal lobe is discussed, there is some text given in a box. Is it necessary to write in answer when we are writing answer?
No, not necessary. Okay, you just know about the name of that physician and what was the research work of that person. Okay, so just you know this. Yes.
Okay.
Ma'am, what is supra-optic nuclei?
Where? From where?
Ma'am, in the diencephalon hypothalamus part, in page number 61.
Page number 61.
Supra-optic nuclei, paraventricular nuclei, and the mammillary bodies.
Yes, these are just the name. I cannot tell you what is this. So because these are just the name, there are 3 important nuclei, and these are the names of this nuclei. Okay? So you don't have to go in detail. You just remember the names of this. Yes. Any question? Now please go through these chapters. I will ask you some MCQ type questions in the next class. And after that, I will start this new chapter, the peripheral nervous system. And when I will finish this chapter, peripheral nervous system, I will go to the next portion. That is, I will teach you the 106, right? So
103, yes.
No, 103. I think it is 106. 106, I think. You can ask in the information of Bikash Bhavan in the IGNOU section. I think it is 106. Okay. So let me finish this part because these are all about brain. So these are very much related about the structures and functions of brain. So block 3, see, it is the brain lateralization, the hemispheric specialization. So I will take only 2 days to finish this brain region. After that, before I start with the glands and behavior, I will start that portion. It is, I think, 106. Okay.
Ma'am, we
So-
didn't get any email for
Email
next
of-
class.
it is now today is 28th, right?
It was the last class.
No, the next class will be on the 2nd June. You will get the mail. Okay.
Okay.
The next class will be on 2nd June. The timing will be maybe it is 11 o'clock. I don't know, that I have to confirm. But you will get the mail. The next class is on 2nd of June. That is Thursday. Okay. And maybe
Thank you.
next to next class will be on again Saturday, that is 4th June. Okay. So thank you everybody. Thank you.
मैम
Yes.
मैम आज मेरे शेड्यूल में लिखा था कि 103 क्लास 103 का आज क्लास होगा बट वो
नहीं।
हुआ नहीं
नहीं सुनो, actually this is our responsibility to complete your syllabus. Okay. Now these are the related chapters. That means the part of the brain, the nervous system, the central nervous system, PNFs. So I told them that I have to finish this part. Okay. So once I will complete this part, I will start the new portion. Okay, so it is my decision to continue with it. So you don't have to be nervous that I will not finish your next part. No, it is not that. I'm just continuing it because I want to finish this related chapters of brain.
ओके
Okay,
मैम
it's all right.
यस मैम
Thank you. Thank you.
Thank you, ma'am.
थैंक यू मैम